Qatar is currently in phase 2 of the impact of Ebola. This specific phase is when the disease has impacted predominantly animals and there's a few human interactions. Information technology can be used in many ways to contain the impact of Ebola in Qatar. In this video, we will look at the different types of softwares and applications available that will enable the surveillance center to predict and maintain the spread of Ebola.
In this section, I'll speak about how we can anticipate an Ebola outbreak using existing technology. One of the ways that technology has been used to predict Ebola is through computational epidemiology. This is where people use techniques from computer science, geographic information, and public health records to better understand issues central to the spread of this disease. It was through the computational epidemiology that a group of researchers and computer scientists in Boston spotted the hemorrhagic fever beginning to spread in Guinea before cases of Ebola started to emerge. Now, there are several factors that are taken into consideration when it comes to computational epidemiology. These factors include social networks, census records, which include family history records of any previous illnesses, and logistical analysis, including medical equipment, hospital staffing, and manpower planning. Another way that technology is being used to predict Ebola is through mobility data. Mobility data is crucial for understanding human movement and characterizing, forecasting, and controlling the spatial and temporal spread of infectious diseases. Flowminder, a non-profit Swedish organization, was responsible for analyzing data from cell phones in Senegal. Using this information, Flowminder was able to build models of population movements using cell phone data and other sources. Now, let's get to health maps. Health maps score the internet for clues from social media, local news reports, and other available data online. The algorithms developed by Health Map had an early picture of the deadly disease moving across West Africa. A combination of the use of the Android app, Facebook, and Twitter were instrumental in Nigeria's fight to contain the Ebola virus. Using information from social networks, health maps produce results shown in this diagram, where they can indicate areas which showcase potential outbreaks of Ebola. Finally, the resiliency and readiness assessment of some technologies show unpromising results. This is because some have called the current technology psychologically reassuring, but not very effective in halting the spread of the disease. The technological infrastructure, especially for high-tech data, is extremely unstable, and technology can be an enormous help in tracking where the disease is moving, as it cannot predict where it might emerge. Technology can be an enormous help in tracking where the disease is moving, but it cannot predict where it might emerge. There have been numerous efforts to overcome these issues and produce more reliable technology. In December, the Egyptian government and Microsoft organized a Technology for Ebola conference in Cairo to take another approach to fighting Ebola, gathering politicians, public health experts, scientists, economists, and activists to think of ways to apply technology to deal with the current crisis and better prepare for the inevitable future outbreaks. One of the recommendations that have been suggested by this conference was to develop custom-built social technologies that health workers could use on the ground in affected areas to spread information about preventing the spread of the disease. A second focused on using mobile technologies, sensors, cloud-based systems to improve the contact tracing and collecting of epidemiological data. The third was to develop a shared data platform that could be used by researchers working on these predictive models.
Disease and how is it gonna go, like the path of the disease?
Yeah, so computational models can be used in lots of ways, right? So you can imagine just a standard stochastic model could be used, but another kind of very fruitful way, which has been used before, has been looking at what's called an agent-based model. So in an agent-based model, you have little agents, little computer agents, which are supposed to represent people, interact with one another, right? So they can interact on some kind of social network or kind of bounce back and forth between different people. So the way that they interact is going to be a huge driver in the dynamics of the spread of a disease. So you can imagine putting someone into a social network, and if that network is kind of tightly knit, then the disease can spread really, really quickly. is that if the network is kind of sparse, right, so he only interacts with 1 or 2 other people, maybe the spread of the disease can be really, really slow. So a big function of how the disease spreads is going to be the social network that the person or the agent is embedded in. And to do that with an analytic model it's too tough, right? It's too hard to do that. But to do that with a computational model, that's really what they're designed for. Right? So you can look at these kind of dynamic or very complicated interactions in a stochastic or a computational way, and that gives you kind of a much better estimate as to the spread and the rate of the spread of a disease.
We're going to be interviewing you about how psychological support for patients and their families, patients with Ebola, and their families in distress, like what kind of support psychologically will they need?
So the World Health Organization has a plan called psychological first aid when there's Ebola outbreaks. And the first thing that you have to do to provide them support is make sure that all their basic needs are being met. Okay, because one of the things that happens with Ebola patients is that they have a lot of discrimination against them. And so sometimes they're not getting all the medical care that they could be getting. So first you make sure that all that is taken care of and that they have all the information they need to kind of cope with the fact that they have Ebola. And then after that, it's basically making sure that they understand that there is support for them, right? And so even if one of the big problems with Ebola is you can't touch the person, really. Yeah. And that's a big part of psychological support a lot of times, is proximity, and having people there that are close to them. So you have to really make sure that even though you can't physically get close to them, that they know that, you're psychologically close to them and that you care about what is happening to them, and but also not forcing them to tell you things about their story and about how they got Ebola and things like that. Making sure that they know that just because they have Ebola, that people aren't going to stop caring for them, and discriminate against them and things like that. It's hard, right? Especially to get countries that are not anywhere near in proximity to Africa to send help for those countries. And so I think, for a lot of people, you can kind of tug at their heartstrings and say, there's a lot of people suffering, but I think you might have to go to the basics of kind of how do you persuade people to do this. So you have to make them feel like this is something that could happen to them as well, and that providing support now could help in the future if something like this was going to happen to them. Okay, so letting them know, if you help us now, that this is going to help us come up with treatments and possibly a cure, to prevent this from happening in your country. So I think you have to get to people's practicality, because a lot of times in order to help someone, you have to relate to them. And I think a lot of wealthier countries have a hard time relating to, Western African countries. So I think that's where you're going to get people to send support, is that they know further down the line this help might be reciprocated in some.
In recovery, we are going to regain visitors' confidence and rebuild trust in health system. We are going to do this through 4 steps. First is video challenge, second is social media use, third is government campaign, fourth is user smart chips. In restoring confidence in visitors, first is the video challenge. The user will be required to create a short video in which they will utter, I live in Qatar and I don't have Ebola. For every video, the government will donate $10 towards research aiming Ebola. The next is going to be social media use. There are going to be doctors and scientists talking on television and will be answering questions posted on social media. Hashtags will be used as they are a powerful research tool and enables people to see what is trending and making waves on social networking websites. Then there's going to be an awareness campaign funded by the government. This is basically going to be a short question. The question is going to be, have you touched the vomit, blood, sweat, saliva of any person who has been affected with Ebola? If the answer is no, then you don't have Ebola. In rebuilding trust in healthcare system, there are 2 steps. First, we are going to install chips in those people who have had Ebola and who are more close to affected people. Then there's going to be primarily healthcare staff. Interaction with patients should not be solely transactional. They need to take care of the patients more effectively. And as all these things get implemented, we'll have an Ebola-free Qatar.
So our proposed solution for the potential Ebola outbreak case in Qatar consists of several factors. First, we have psychological assistance which needs to be provided for people from different ages and nationalities in Qatar. This is to prevent a state of fear and chaos within the country and to help maintain a calm environment in which people can communicate with each other regarding the progress of Ebola. The second proposed solution is education. The people of Qatar should be aware of the cases and the symptoms of Ebola in terms of the fever and the medical conditions that they may suffer while having Ebola. If a person receives any of these symptoms, he would know directly to go to the hospital and to be contained in an environment where the spread of the disease might be slowed down or reduced. Third factor is development and research. The government of Qatar should invest substantial amounts in order to identify new technologies or cures that can be used in order to reduce the spread of Ebola or eliminate the disease. Third factor is development and research. The government of Qatar should invest substantial amounts in order to identify new technologies or cures that can be used in order to reduce the spread of Ebola or eliminate the disease. Financial support. Financial support should be provided for institutions and organizations who are trying to reduce Ebola by identifying new technology and new cures that will be able to prevent the disease from spreading. The government in Qatar should establish a system which raises awareness regarding on how to maintain a hygienic work, school, and local environment. By maintaining a hygienic surrounding, the risk of Ebola spreading from one person to another is reduced by a great factor. Another proposed solution includes improving IT infrastructure. The first way to do that is by reducing maintenance costs and improving productivity by recovering lost application knowledge. Many organizations invest millions of dollars in business intelligence software to collect and analyze operational data in order to gain better insight and help optimize their business operations. Yet, there is little or no investment made to understand the systems that capture and process most of that operational data. Application analysis tools can help improve the productivity of the IT systems by automating the manual processes used by developers, analysts, and others to learn about existing legacy systems. Moreover, you can improve the predictability of project success through governance and best practice guidance. Process improvement involves adapting the best practices for processes and measurements. These are used to help accelerate overall software delivery, minimize rework, and reduce the cost of change. An example of the best practices may include iterative development, continuous integration, and evolutionary architecture. Third is to optimize infrastructure. The way to do that is by employing a quick and low-risk way to improve performance and the availability of the existing IT systems to ensure that the company is leveraging the latest computer technology. We also have agent-based models. Agent-based models are computer agents that represent people who interact with each other the way they interact in real life. They provide a huge dynamic on how the disease is going to spread. Hence, the spread of the disease is going to be slow by looking at the data and analyzing it to identify where people are actually communicating the most. New technology that we are proposing is to install smart chips in people who have had Ebola and people who are susceptible to having Ebola. These chips would sense the changes in the body and the information will be used to see if any abnormality occurs. As a result, doctors will be able to take quick action, and this is similar to the chips that are installed in people who have cardiovascular diseases. The chips for the heart patients measures the heartbeat, their temperature, and other factors that may lead to them catching Ebola.